Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to be talking to you about treatment strategies for shoulder pain. The shoulder is kind of a complicated joint. If you're suffering from shoulder discomfort or pain, you're definitely going to want to stay tuned because at Maragal Medical, we've got some very innovative treatment options that are going to help you solve your shoulder problem. So stay tuned. Okay, Dr. Mike, it's interesting how different complaints kind of pop up. It almost seems like it's contagious, but we've seen a lot of patients recently come in with shoulder pain and discomfort. I've talked about, my history with shoulder pain. As you recall, freshman year at UMass, I injured my shoulder. My chiropractor found out it was my neck causing pain to go into my shoulder. Years later, skiing with my family, I fell on my shoulder, actually caused a shoulder problem where I partially tore my rotator cuff, had great response to regenerative medicine. Why is the shoulder such a tricky area to treat, and why is it so prone to injury?
Well, if we think about the shoulder, we classically think of a ball and socket joint. We all have heard that concept is the ball and socket joint of the hip or the shoulder.
Yeah.
But in the shoulder, the socket is very small.
Yeah.
That means we have a lot of range of motion of the shoulder. And in order to have that amount of range of motion, a lot of things can go wrong.
Right.
So you can strain the ligaments, the tendons, the joint itself. And then you have the AC joint or the acromioclavicular joint up top, where people say they have a separated shoulder. That can get involved with the collarbone. And then you have the joint itself. So you can get arthritic or injury to the joint. And then most commonly we think about the rotator cuff, as you mentioned. It's a group of 4 muscles that surround that ball of the ball and socket joint that gives us this large range of motion. So each one of those tendons could have some strain or injury or damage in some way. And it hurts when we can't do what we wanted to do. And then we additionally have a biceps tendon, so we all know our biceps are in our upper arm,
right.
But one of the 2 tendons of the biceps enters into the shoulder as well.
Right.
So there's a lot of moving parts in a lot of areas that can get injured.
Right. And talk about previous injury too. When I was a senior in high school making a tackle, I broke my acromion. And then years later, I was really shocked when I had the MRI for my shoulder on how much arthritic change was in my AC joint, and kind of gives me that prone ability to flare it up from time to time, just because that space where some of the rotator cuff muscles pass under now is significantly narrowed. But at our clinic, we kind of look at it a little bit differently. So we always talk about, treatment options compared to the typical medical visit or orthopedic visit. I remember when I was a freshman at UMass, I came home, saw the orthopedist. Right away, he went for the syringe and injected cortisone into my shoulder. Of course, that didn't really help. What are some of the treatment options that we have for our patients with shoulder pain?
Well, we first go into those diagnostic tests as well. So
Okay.
we do the orthopedic evaluations and make sure that we're looking at a tendonitis versus a bursitis or, again, a partial tear.
Yeah.
So we might need a rotator cuff evaluation with an MRI and things.
Yep.
But once we have that information, now we say, well, how do we preserve the tendon? How do we knock down the inflammation, but also then make it longevity of long-term benefit of treatment? So we need the physical therapy exercises, which we can do here in the clinic.
Yeah.
We want to do injections, but we don't want to do cortisone. We don't want to make anything that potentially could cause damage to the tendon itself. So we think about our platelet-rich plasma injections that are much more restorative and kind of repair the tendon to actually have some long benefits in the time. And then we got to think about, okay, the joint itself, is it moving correctly? As you mentioned in your own neck, is there a connection to the neck component, looking at the nervous system coming through? So we want to make sure that there's good movement through the joints. And our chiropractors can get the neck movement, the shoulder movement, and again, all the muscles that attach. We think about those soft tissue trigger point injections. So we're really looking at it from the whole collection of the so-called shoulder girdle that we think about, that there's a connection to the neck, to the arm and shoulder, and even all the way down the hand.
Right, and I had an awesome response to one of the types of regenerative injections that we do, that Wharton's jelly allograft, which is very rich in regenerative cells. I think there's a lot of confusion still out there though with the public, and we do a really good job of being very strategic. That's why for insurance reasons, usually start out with an x-ray, but really to properly treat the shoulder, we need that MRI because we want to be able to see those tendons. And what we're looking for is whether or not the rotator cuff muscles are partially torn versus fully torn and retracted. And I think, looking back, there's definitely some confusion about what is a partial tear. Does a partial tear need, immediate surgical intervention? Can you treat a fully torn, retracted tendon with regenerative medicine? How do we clear that up for the public?
It's a little bit more complex to think about, but the MRI does give us that detail, so we can actually see the thickness of the tendon, if it's kind of shaved down or partially torn as a thickness component, and then there's actually, the tendon can be cut through, and any of those kind of changes will be painful.
Right.
So to think that when you have pain that you have to go right back to the surgeon to kind of shave it down, repair it, and retract it, well, most of the time if it's fully torn, an injection is not going to do anything because it can't bring it back together.
Exactly.
So you might need to think about a surgical evaluation if you have a complete torn. But if we think about, you're talking about a sports injury and shoulder injuries, anyone who can have activities, shoveling as it comes up to the winter can kind of aggravate the shoulder. Working overhead, just working at your computer. So all these things can be more soft tissue, gentle aspects of repetitive strain that is not going to need a surgical intervention, but you may have a lot of pain involved.
Right.
That's where, again, we think about, okay, looking at that MRI, seeing what's inflamed, what's swollen, and then we can decide, hey, look, we want to go after that one tendon of 4, not just injecting in the general space.
Right.
We want to go after the treatment in the rotator cuff of which that motion takes place, not just randomly think about, okay, just do these bunch of exercises and you may feel better.
Right.
Because the goal here is to be strategic and get in it with the laser to kind of decrease some of that inflammation, use a little bit of medication for a few days only, and then get a person off those medicines and work naturally. So we're really looking at it from more detail as much as we can in that aspects of multiple pain generators.
Right, and I know in my case, I had that partial tear. It was still attached, so it was my supraspinatus muscle, and they kind of labeled it. It was a decent, like a linear tear, had a hole right in the middle. It was about 6 millimeters long. So we went the surgical consultation route. That just wasn't an option for me at that time. Given my physical nature of the job, I'm a chiropractor. I couldn't be out of the practice for 8 months, and that's when you and I discovered the science behind regenerative medicine. I was kind of the guinea pig. So with those those partial tears,
right.
I always tell patients too, you have really nothing to lose from the regenerative medicine aspects. You can always do the surgery, but I'm living proof. My shoulder is completely fine. I'm playing tennis tomorrow. I play a couple times a week, and that definitely really changed our perspective on how we could treat patients more conservatively, where we're using treatment options that help repair the damage versus the surgical option or treatment options that actually cause more damage too.
Yeah, if we think about the word regenerative medicine, which is kind of the buzzwords that we now hear, really it's a reparative properties. We're not regenerating the tendon that has a partial tear, but we actually are stimulating the body to bring in blood supply, and that's how nutrition gets to the tissues to cause the ability to help heal the wound.
Right.
And if the tendon has ability to heal, we want to regenerate the vascular supply to it. We want to decrease the inflammation, let the body naturally heal. So we like to almost use the words reparative medicine as opposed to regenerative medicine. But again, they're buzzwords to say we can do something that's much less invasive than a surgical intervention.
Right, and it's really something that you see changing at a microscopic level, right? Not at a comparison level where you're looking at pre and post MRI. These are subtle changes that make a huge difference. If you're interested in looking for alternative options for treatment for your shoulder pain, you definitely want to give us a call at Maragal Medical. More information can be found on our website at maragalmedical.com. There's a great library of YouTube videos that we have accumulated, over the last 2 years now. By going to YouTube and just typing in Maragal Medical, you'll have access to that. Well, that's it for today. I hope you learned something, and we'll see you soon.
Take care.